You might have blue eyes, you might have brown eyes, hazel, green eyes. Mine are both. You might have flecks in them. There's no two eyes are alike. And we are with Dr. Heaton Lakhani right now from Global Laser Vision. He's going to explain how each eye is unique and what that means for you as far as LASIK is concerned, right?
Correct. Hello.
So, yeah, hi.
Hi.
Good to have you.
Welcome. Good to see you.
I want
to
touch the magic hands right here that do the work. What do you mean no two eyes are alike? Besides the obvious.
Yeah, well, we all know that everybody is different individuals. They have nearsightedness, farsightedness. People have difficulty with seeing up close and things like that as you age. Well, we now know with technology that there's actually differences with each individual eye. We know that there's a uniqueness similar to a fingerprint or a DNA pattern, that each eye's visual pattern is completely different from the other eye. And that allows us to then specify our treatments accordingly.
Wait, from the other eye, and does that include everybody else's eyes on Earth? Because like our fingerprints, nobody has to.
Right, so each individual eye and then each individual person. So you are defining your treatment specifically for each eye. So not necessarily just the individual, but the whole.
Right, so you have to look into this eye, obviously, and come up with the right answer.
Correct.
And you guys have done over 45,000
We've done
surgeries.
tons of cases, yes. And volume is very, very important in terms of choosing a surgeon, because that allows you to see what they've seen, and they can go through all their experiences with you in terms of how your eye is to be treated.
Okay, well, let me ask you this then. If every single one of them is different, how does that affect how you do your LASIK surgery?
Well,
does it make it easier, harder?
It actually, with the technology we have right now, makes it tremendously easier.
Really?
Because we have the ability now to actually map out that whole wave pattern of light as it goes through the eye. It's a technology called wavefront technology. And interestingly, it was based on technology by astronomers as they were looking through high-powered telescopes to try and reduce the distortion. They took it to the eye model and were able to do the same kind of thing, send light through the eye, measure it as it comes back, and really know every little distortion that's of a higher order sense than the normal standard way of measuring.
And you can correct these distortions then.
And you can correct these distortions.
In that custom fitting.
Correct.
Or whatever. But what do you actually do?
Well, and you brought up custom, and that's the nice thing, that we've taken laser vision correction to a tremendously personalized level where we customize our treatment for each individual person, each individual eye. We create a map, and that map is a contour map as well as a wavefront map. We take that, we then incorporate those diagnostic tools and really define precision in terms of our treatment on the eye. So we apply a laser that has the ability of taking that map and actually placing it on the eye. So we find that with the newer technology, 25% greater accuracy in terms of being able to see clearer. These folks that we do surgery on have better vision than they've ever had.
Well, I was just going to ask you that, with the new technology and how it's applied, the efficacy rate must just be bounds and bounds, just compounding.
Absolutely. In fact, with the FDA studies 5 years ago, and things have changed tremendously since then, showed that 98% of the folks are 20/20 or better. And the most important fact is that 70% are 20/15 or better. That means they're better than 20/20. They're what we consider supervision.
Well, yeah,
we like that,
so,
supervision.
If you were to come work on my eyes, I could go then join the Air Force. I could go fly.
Correct.
Right now, what about astigmatism?
You have to know how to fly. Sorry.
Oh, yeah, that's right. You got to get those whole flight lessons first.
What about astigmatism, like I have on this eye? What do you do for that?
Astigmatism now is just generally like any other prescription. We have ways of treating it, even the higher amounts compared to what we had 10, 15 years ago.
Oh, wow. Okay.
So,
right.
So a greater precision in all of this.
What do you do for people, though, that are nervous about coming in? Because, I mean, the image that I have in my mind of when LASIK surgery first came out, people were in these things, and, you know, I just have this.
True. That's true. Well, we urge everyone, and that's a very important question, because I think a lot of people try not to do it because they're worried about someone getting near their eye. The nice thing is that in most surgeons' hands, the procedure is quick, 10 minutes an eye, very quick, and there's no pain involved. So we kind of have people come through our office. We want them to feel a personal touch care. We want them to know they're meeting the surgeon, they're getting all these new diagnostic tools to really make sure that we're treating them individually.
Support with information.
Thank you, Dr. Heaton.
Welcome.
Thank you.
You
if you're ready to ditch the glasses, you call 1-800-GET-LASIK. You see it right there, all right? And the number is right there, too, 800-438-5274. Check out the website, globallaservision.com. I need to be over. I'll be over this afternoon.
Okay, when we come